Okay, let's see. Which of the following treatments would be most appropriate for managing this patient's symptoms? A 19-year-old man is brought to the ER by his friends who report that he has been experiencing hallucination and disorientation after smoking marijuana at a party. The patient appears agitated, paranoid, with bloodshot eyes and elevated heart rate. His medical history is unremarkable. So, which of the following would um, be best to manage this patient's symptoms? So, obviously, like he is on marijuana, right? Um, and from the symptoms, I believe he's withdrawing from marijuana, right? He's not currently intoxicated. Do you think is that right?
No, I mean, following kind of, your train of thought, right? He's coming, after he smoked marijuana, right? And then he felt agitated, paranoid. So what do you think you want to do for him?
I think right off the bat, um, if I remember correctly, I'm between opioid antagonist and beta blocker, but I think the beta blocker comes first.
Okay. Talk to me kind
Uh,
of how you came up with beta blocker.
because I think the fact that he has an elevated heart rate, I think first and foremost, we kind of have to deal with that
Okay.
before anything else.
Okay.
Um, benzos, right? The benzo picture. Benzos, they work at the GABA channel.
Okay.
Um, yeah, no, benzo, I know like benzos also works for like sedatives,
Okay.
but I don't think we would want to use like a sedative here. Antipsychotic to block dopamine. I don't really see that. Um, opioid antagonist, I was not going to like thinking maybe okay, it could be like opioid antagonist, but like I feel like even that, like when it comes to like heroin and stuff, we want to give like a partial opioid agonist, like fight at the receptors, if I remember correctly. And stimulant medication, just like why?
Sure. Okay. So it's actually going to be benzos here. Okay, let's talk about why. So he looks like
Okay.
he's overdosed on marijuana. It seems like he smoked too much, actually, not withdrawing, because he's agitated and
Mm-hmm.
paranoid, which are one of the side effects of having too much marijuana in your step one that they'll say, and then he has a bloodshot eye, right, and elevated heart rate because he's probably paranoid. So to relax somebody, most of the time, I would say if you're agitated or aggressive or anything like that based off of taking drugs, your next best thing is taking benzodiazepines. Okay.
And which one specifically?
Um, I mean,
Any?
yeah, the short acting ones I would assume, but I'm not 100% sure. I think it's a short acting one, but no, yeah, diazepam or lorazepam. I think these are moderate acting ones actually.
Mm-hmm.
Um, but yeah, these will help you kind of calm the patient down, right? Antipsychotics, like you talked about, right, mainly for severe psychosis and agitation. Not here. Opioid antagonists like naloxone is used for opioid overdose. So if you're like really overdosed on fentanyl and you're kind of snowed out, then naloxone is good for it. Stimulants, amphetamines, methamphetamines, usually for ADHD. Beta blockers can treat hypertension, angina, arrhythmias, and then can reduce the heart rate, but it's not going to decrease the agitation, paranoia, and hallucinations. So
Oh,
to
I
treat all
see.
that, you want to give a benzodiazepine.
Benzo, okay. Because essentially when you reduce the anxiety, you would reduce the heart rate too.
Yeah.